Good evening, social media friends and family. This is Arthur Charles Taylor. As an author, it's a pleasure to present you all with information that can be used to pretty much describe who I am as a person and or as an author. However, there is no argument that anyone can use to dispute the fact of how far you can go with the right information. And I'm definitely going to give you the right information on today. Topic of discussion is going to be trauma-related stress disorder. Trauma-related stress disorder is something that you develop over time, right? It's not like a condition to whereas you are diagnosed without having prior knowledge of this particular condition. A disorder means that at one time you were orderly or stationary or stable within your thought pattern, within your behavior and your characteristics. Unlike situations where individuals are born with a deficiency of retardation or some type of deformity or dysfunction, mental illness is serious in society because it affects 21% of our U.S. citizens from ages 18 to 24. I've come to realize that after reading the story, that these conditions, or better yet, this disorder is based on experience. Where a guy had encountered being in the military, and he was an Afghanistan war veteran. Throughout his course of being in the Marine Corps for 6 years, I'm pretty sure he saw some very catastrophic things that distorted his thinking. Those stress-related trauma experiences led him to have some type of postpartum effects that caused him to be disoriented in his behavior, in his characteristics. Furthermore, those behaviors causes other people to be skeptical about your behavior, your characteristics around them as well, because he stayed with his father and his stepmother, and they noticed that he was staying in his room a little bit too much. He was calling off twice a month, and he done this for 5 months straight. You would miss 10 days of work within a 5-month period, all due to a disoriented disorder that you developed while you was in the Marine Corps for 6 years in the Afghanistan war. He said he was practically fine, and even the family said that they didn't see the fact that he seemed to have been physically doing well. Okay, no problem. With that being said, a lot of people look like they're doing quite well, but internally, they're suffering from trauma-related stress disorder. The process of diagnosing a person that has trauma-related stress disorder is observation. Because those type of individuals have a tendency to become isolated and socially distant in their behavior and their characteristics. The conduct is quite obvious. The illustrations of display in reference to characteristics are noticeable. Diagnosing this problem of trauma-related stress disorder causes individuals to be depressed, experience high levels of anxiety, and even go through post-traumatic experiences of having flashbacks of what they previously experienced. So he might have been mentally experiencing all kinds of things, reliving those experiences of being in a battle or maybe killing somebody. And the people that are affected are young adults from 18 to 24. With that being said, I've been affected. I've been affected since I was 14 when I first caught a juvenile charge. And I went back at 18. And I went back at 22, right? So there is a fine line that kind of verifies clarity in reference to who's affected and how you are affected by this trauma-related stress disorder syndrome. Disoriented means being mentally dilapidated, requires a strategic method of approach in reference to how you treat the situation, whether it's yourself or another individual that you may be affiliated with or associated with. I recommend that you do more research on these conditions, and I will be back to give you all more information in reference to community mental health. My name is Arthur Chauncey Taylor. You guys have a great day.